and welcome to O Health by Dr. T. I am Dr. Marlene Cordova, and this is my radio show where I hope to be the bridge between traditional medicine and alternative medical practices. And today in our show, we have Ivette Pinela. She practices Rolfing. She has been doing body work for 27 years and now Rolfing work for the last 17 years. And her practice is in Fort Lauderdale. Welcome, Ivette.
Thank you. Thank you, Dr. T. I'm excited to be here.
Yes, I've been telling people about today's show, and they're like, what's Rolfing? What's Rolfing? And so that's why I'm so happy I decided to have this platform to be a bridge to bring together this information to inform so that patients can hear what's possible, what's out there that could help them heal from something. So I'm so happy that you have made time to join us.
This is so awesome. I mean, to have a doctor that I love that you're using the bridge, the connection that you have being in the medical field and introducing alternate holistic therapies. This is a wonderful opportunity. So thank you.
Thank you. So what is Rolfing? Tell everyone what that is.
What is Rolfing? Well, that's always.
I know it's body work, and I have an idea of what it is now for sure. And I've researched it, but I would love for you to explain it since you've been practicing it for 17 years.
Well, Rolfing is a type of body work. Most people don't have a reference for it. So it's not really a type of massage. It's body work, meaning I work with a different tissue in the body. I work with fascia. I work with getting the patterns back into balance, both between the fascia, the bones, basically everything in your body is covered in fascia. So as a Rolfer, I'm trained to more directly affect the fascia, but as a whole. Meaning, let's just say, for example, if you played tennis for 20 years of your life, there might be a pattern into your arm of how you use your arm with the racket. So that in itself would be stuck in the memory of the fascia, wrapping both the muscles, the bones, but things that you don't think about, like tennis isn't just played with your arms. Like you couldn't move your arm without having the stability of your rib cage. So you don't really think about how playing tennis for 20 years might affect your whole rib cage. And it's just a complete domino effect. If the fascia around your rib cage is affected, well, there's a good chance that even the fascia around the organs might be affected in your rib cage. And therefore, how is this affecting your legs? So we can go on and on.
The whole body. You're actually educating, maybe, and I'm sure you educate your client, your patient, your client on how everything's connected. I'm sure that you empower them with a lot of that information that they're not teaching in school, but they don't teach this in school. So that's what I tell my patients. I'm like, it's okay. They didn't teach you this in school, but I'm sure you have to bring that into their awareness, right, into their consciousness, how it's all connected and how everything affects everything else.
Totally. The difference being, the way I like to explain it, most people, when they have gotten a massage, maybe they have an experience with trigger point therapy, and they have felt a relationship in their body of like, oh, wow, you're pressing here, but I feel it over here. But it's a different reference because it's a three-dimensional map. And I say that because most of the time I can talk until I'm blue in the face about Rolfing, and they're like, well, yeah, because you don't really have a reference for that level of touch. In other words, for the body actually being three-dimensional, like muscles, one point A and point B, and how those 2 points work is not, I'm working with like the whole sleeve of like the whole arm, the whole sleeve of the leg, of a rib cage. So it's a little different, but it's really awesome when they finally feel it and they start connecting like everything I've been saying to like, right. Oh, this is what she means. It's kind of like explaining what chocolate cake tastes like if you've never had chocolate cake. It's a lot of fun.
That's a good way of describing that. So Rolfing is body work. You're touching the patient. So everyone out there listening and watching this, it's body work, and you are working with fascia. And can you tell everyone what fascia is, what that is in the body, and where it is in the body? Can you tell everyone listening what is fascia?
So a really good example of fascia is like if you take an orange, like the white skin of the orange would be like a superficial layer of fascia in our body. But it gets more complex than that because each segment of the orange is also individually covered by this connective tissue. And then if you were to break that open again, you get a much deeper layer where each individual pulp is also covered in fascia or connective tissue. So hence our bodies, it's not just underneath the skin, it's each wrapping of muscle from superficial to deeper layer is wrapped in fascia, as well as how the muscles, ligaments, and tendons, as they stick to the bone, it's all through the connective tissue. And even where your organs are wrapped in a way where the fascia actually maintains them, like your heart, liver, everything, where it's supposed to be and how it's supposed to work because of the fascia.
And Rolfing is body work that addresses the fascia, correct?
Correct.
Great. Like, I think a common thing some of you might be aware of is plantar fasciitis, because the actual fascia word is in that diagnosis. So that's a good example to start with. The bottom of our feet, it's painful feet. It's very common. Yes. And you probably do have a lot of patients with that. And is this an example of where Rolfing can be very beneficial?
Sure. But that's also where you go into a different dynamic. So I would say that in general, mostly clients come to me because they are in some sort of pain.
Right.
Now, that being just one example, and obviously because it has the word fascia in it, it's a
that's just so everyone out there can, like, plantar fasciitis, I think, is a pretty common term nowadays, and a lot of people do have it. In my office, I have a lot of patients, so I just wanted to use it to kind of get everyone like, oh, okay, that's the fascia on the bottom of the foot, and it hurts when you touch it, and there's stretches and exercises, but not, many people, it becomes a chronic condition. And so yes. Rolfing, anyone out there, just know that Rolfing is something you might want to look into if it hasn't resolved, if you have not healed from the plantar fasciitis diagnosis. And we're going to talk more about all the different conditions that you can use Rolfing for. But I wanted to ask you, what is your story? How did you come across Rolfing? Because I know you did body work for 27 years. And for the last 17 years, you've focused on the practice of Rolfing and only that, correct? And how did you yourself come across that? And why have you chosen to focus on that?
Great question. Thanks for asking that. So when I was about 23 years old, I took a nasty spill and I fell on my butt. Some other things happened in the process, but basically I really hurt my pelvis. That evening when I was taken to the hospital, they took x-rays and I was in a lot of pain, but the doctors were sort of mystified and they could not see any reason for my pain. To them, there were no broken bones. There was nothing going on. I left with a pharmacy of pills for pain. I left, not really wanting to take them, but tried taking them. But usually when I would take the pain pills, I would still be in pain. So to me, there was a problem. The more I complained, the doctors they couldn't really hear where I was coming from. I, demanded to get an MRI. The MRI, again, showed nothing was wrong with me in medical terms, or at least none that showed.
So the MRI was normal, right?
It was completely normal. It doesn't show connective tissue.
And you were in a lot of pain, like on a level of 10 being the worst pain. What level were you in?
12.
12. So you were in a severe pain and it was chronic?
It was hard to walk. It was hard to sit.
It affected your life.
Hard to do anything. Eventually lost my job because I couldn't do it. I mean, I could barely drive if I was taking pain pills, and I could barely work on top of that.
Yeah.
Well, eventually the long road forward was basically being diagnosed and being told that at the age of 23, I wouldn't be able to walk, stand, or sit for more than 20 minutes at a time, which I remember thinking, well, what can I do for
that
work?
Doesn't sound good. You're like, that doesn't sound good.
Yeah, I wasn't ready to accept that as a diagnosis. I felt like I'm 23, that I'm not 98. And from then on, just decided that I was going to, like, that it just wasn't enough. Like, I needed to find a way. And that started by going to massage school. So within 6 months, just from getting massages from students, within 6 months, I could do 2 one-hour massages and carry a 30-pound table. So immediately, I knew there was a possibility for me.
Great. You've had hope.
I had hope. There was light at the end of the tunnel. But as most of my patients find out, massage is just like just a gateway. It's a gateway. I mean, for me, because my problems weren't really, in my muscles. It was starting, like, so now already a year had gone by since the actual accident that I had.
Right.
So like most of my patients, you might get relief for a little bit, but then in all actuality, the trauma has actually never been touched. It's like kind of like when you're walking around with a pebble or 5 pebbles in your shoe. You don't have time to get them out.
So massage worked on the muscles, and it kind of helped you. It seemed to help you to a degree. To a degree,
to the point where I could go back to work. So fast forward.
But it doesn't address the fascia.
Yeah, it'll address the fascia, but sort of indirectly.
Right.
Like you get some sort of relief, but after a while, the massage itself becomes compressive to your own body and to the therapist's body. Speaking from my experience, I was working very deeply. This is my pre-Rolfing years, where I had heard about Rolfing, but in my mind, I thought Rolfing was something just like, like most people, they think, oh, that's just deep tissue massage, right? And I'm like, oh no, not. So basically, after kind of like messing myself up, because I was doing very compressive work to my clients and to my own body, I finally got introduced to a Rolfer. And it was just super life-changing. Like 90 minutes, my whole life changed. Like
wonderful.
Yeah.
I could feel it. I feel it the way you tell the story, how life-changing, how emotional that is. What a moment for you. Yeah.
It was amazing. It was amazing. Like, it's one of those, like a lot of my clients, like, you're in tears the minute you leave the office, because now you really know that there's hope.
Yeah.
You know that somebody has finally understood something about your body, or something is finally going to happen. Like, my life can finally change from here.
That's great. That's wonderful. Thank you. So that was it, I guess, for you. You're like, okay.
And, from then on, I was on a new mission. I was like no longer satisfied being a massage therapist. And it took me an additional amount of time, because before going to massage school, you have to actually receive the 10 series, which is actually how this work is usually practiced. It's called the recipe, and it consists of 10 sessions. And so I had to actually receive the 10 sessions prior to even thinking about going to school. It's actually one of the prerequisites.
Okay, good. And so now we are here 17 years later. Your practice is in Fort Lauderdale. And how can someone reach you and make an appointment? I mean, I wanted to make sure that I let everyone know that right away before I move on with my many other questions. So they go to your website. The website should be listed there in the video.
Yes.
It is www.rolfmesi.com, ROLFMESI.com.
Yes.
rolfmesi.com, and on her website you can make an appointment. She has a questionnaire because she wants to make sure you're a good fit, and that you have your little screening process. So, and also always go over, talk to your doctor, and of course if I'm the kind of doctor that's very open-minded and integrating these alternative methods. And that's why I love meeting you, and we'll continue to meet all the different practitioners of other practices that help people find healing and get their life back, feeling happy and free of pain, right? So, because chronic pain is on the rise, chronic conditions are on the rise. And I know that Rolfing can help people heal from these conditions. And that's why, of course, we're doing the show. So can you explain, why would someone go and choose Rolfing? Why would someone do that? Anyone with any kind of pain? Is it any condition, or what are the categories or the kinds of diagnoses and kinds of conditions that Rolfing is really good for?
So I'm gonna just say things just a slightly different way. So there's a quote by Ida Rolf that says, the gospel of Rolfing is, I'm gonna basically put order into your body, and from there we'll kind of see what that can create.
So anyone can get it, right?
Anyone. You actually do not need to feel pain at all.
Perfect. Thank you for clarifying that. That's a good point. So anyone with chronic pain and any diagnosis and on medications that they want to come off, or even patients that are told they might need surgery, this is an option. And also, if you just want to optimize your health and well-being and optimize your body structures, this is also a good option for you, because in our clinic, we do promote well-being and we want to take it next level. So you might be feeling pretty okay and not in pain.
Yeah.
And you could go get Rolfing so that you can optimize, right, the body structures, even circulation. You can boost immune system probably. What are the benefits if you don't have any pain and you're feeling pretty good? What are the benefits?
There's a lot of benefits. So if I can take you through the 10 series. So what I actually I teach people how to breathe. And even though you are already breathing,
that's important.
Okay, so frame of reference. So right now you're breathing, you're sitting, right? Very comfortably, like you do all the time, right? But what if I went in there, opens up your back? What if you weren't aware that your back was somewhat glued? We'll say, what if right now you're only breathing at a 30% capacity, but you weren't aware of it because, like, I'm breathing, I'm alive, I'm doing what I'm supposed to do, in, out, I got this. So it's basically that. It's like after one session, which is the first one, I'm going to teach you how to breathe. I'm going to hold one hand behind you, because when your lungs expand, they actually expand three-dimensionally, in the back, in the front, and in the sides, all at the same time. But there's probably a good chance most people, just as long as their chest is rising and falling, that's breathing for them.
And I find that in my office all the time. It's funny. I'm glad that you even take that a step further and really teach them, because that our breath is so empowering if we can learn how to use it to our benefit, and if we have that awareness of how powerful that is. I often have to actually teach patients how to breathe myself. I'm like, let's teach you how to auto-soothe, soothe yourself, calm yourself down. So thank you for bringing up that very important tool that we all have with us all the time. Thank you.
Yeah, the breath is powerful. And so that's really where we start. It's a process of empowering the client. So it's a process of giving them a space and then teaching them how to use it so they can make that choice. Like, because somebody I can give you the space, but you can just walk out and not choose to be in practice. In other words, like drinking 8 glasses of water. It's like, we all know it, but we may not practice it, right? Good one. Thank you.
Oh my gosh, hydration. Thank you for, I mean, hydration is so important, right? For the body structure. I'm sure you preach that constantly.
Yes, yes. So in other words, yeah, so breathing is like water. It's essential. It's essential. And like you said, it's a great place to start. I love the quote by Ida Rolf that says that we build the body around the breath.
Yeah, I like it. That resonates with me.
Totally. Yeah. So it's basically, it's like the breath is the engine. That's where we're going to start, you know? So we've got to give you the breath like right away.
And then you get to work. Yep. And then what?
Yeah. And then from there, it's a process. Like from the breath, it literally, it's like Lego blocks. So once I give you the breath, we actually go to the second session. We start to rebuild your feet. And interestingly enough, once you start breathing into your back, when your diaphragm drops down, it actually lengthens your feet and ankles down into the ground. So it's like the first session automatically is leading us into the second session.
Great. Good. So it's 10, is it typically 10 sessions?
Typically, yes.
Okay, good. I wanted to ask you that. What does that look like for anyone listening? How many sessions is it typically? So it's 10-session program because it's a process, correct?
Correct.
Okay.
It's a process of educating how each beam connects into the next beam, and kind of more bringing in awareness. Like you said, you're very aware when a patient can come in and they're not using the breath as a healing modality, right? That's the first thing you want to teach them too. Like that's the foundation, right?
It is. Definitely, we have that more conscious conversation at Home Health at my practice. The conversations are definitely more conscious of the patient's awareness too, and we try to awaken them to themselves, right? To their own power and their own abilities to heal themselves with education, with being provided that space, right? Of course, we're a primary care office. We're going to make sure they're okay. We're going to do the checkup, but the conversations always wind up guiding them back to themselves and teaching them how to take better care of themselves. And it sounds like Rolfing is a great contribution to that, so that they can understand their bodies, almost reintegrating them, almost getting them back to themselves in that process of the 10 sessions, really getting to know their bodies, how to take care of their bodies, how to breathe, the hydration, the posture, you probably help them move. Maybe body mechanics too. Do you get into that? Body mechanics, mobility, posture probably improves.
Well, yeah. So, I mean, I'm creating the body that way. So from session 1 to session 2, I'm going to give you your foundation right away. The awareness of where do your feet belong at the end of that session? Like, where do they fall, and where have you trained your feet to fall, which are two different things. Like most athletic people, they stand really wide. They stand with their feet kind of at shoulder width. It's like they're ready to do a lunge on command. But in reality, from a structural point of view, your heels actually belong groin width apart. And that's where it's most optimal to support your spine.
Okay. So what is the proper way to be standing? What should be the stance? Feet, how far apart should the feet be?
About 3 to 4 inches wide.
Okay, and the weight, what do you recommend the weight should be more on the heel, the center, the sole? How do you help the
Um,
patient guide their weight, their stance?
well, they sort of learn a piece of that throughout the 10 series, but you know, the first one, like when they get their feet, they're kind of noticing, hopefully by then I've unstuck their heels and created like a lot of core space, like energetically through the bones.
That's very important.
Yeah,
That's huge. That's like the roots, you know. So then,
exactly.
yes, can you go
Exactly.
over all 10? Like, do they have names? The 10 sessions?
They have names, but kind of Rolf language. They're really just numbered.
Oh, they're numbered.
1 through
Okay.
10. They're numbered, but you know, in Rolf talk, we'll say it's the first hour, the second hour, the third hour, the fourth hour, but it's numbers.
Okay. So I guess do you work your way up?
Yeah. Well, we go from the feet, then we go to the sides, and that's a really interesting session. So like there's, you know, each session, it's kind of like rebuilding the whole house, basically. Like you wouldn't go and say, I want to do the roof first. You kind of want to rebuild the foundation first and kind of go from there. I don't know how.
That makes a lot of sense.
Yeah.
Yeah. Yeah. So it's about 10 sessions, about an hour. How long are they? How long is usually each session?
They're about 90 minutes each.
Okay. And is there any contraindications?
As far as contraindications, I would say cancer.
Okay.
It's definitely a contraindication.
Okay.
And forms of osteoporosis.
Okay.
You know, definitely if the bones are brittle, because I am putting, you know, some pressure into the body and working with realigning a bone, that would be a contraindication if the bones were somehow weak.
And do you sometimes we have to request a clearance for maybe their primary, like if they do have osteoporosis, but they still insist? Are you okay
Yeah.
proceeding if you get a clearance?
Yeah, most of the time it's people that have had surgery. If you've been working with the doctor, then I definitely will say it's not really up to me. I haven't been taking care of you, but you need to have clearance from your doctor.
So that's good. You're open to that as long as you get a clearance.
Oh yes,
and
as
how,
long as I am. Yeah.
And so you said the other one was cancer. So anyone undergoing cancer treatment, is that what you mean? Anybody undergoing cancer treatment and with a diagnosis of cancer? Or what if they're in remission?
Remission wouldn't, yeah, that's not a contraindication, but there is
a time?
Like well, not a time. I mean, so obviously you don't want anything that they have that's going to spread. You don't don't want, right? Because I could encourage that. That would be the thing, right?
So do you always get a clearance from maybe their doctors?
Yeah, but also just, I mean, I think most people wouldn't seek out that form of therapy. They would seek possibly a more energetic or something different.
Okay, good. Good to know. That's important. That's important for everyone out there listening. Okay, and I do try to bring that to this platform, all the different other modalities on this show, so that whoever's listening, if something resonates with you, and it's good to know also that you have your screening purposes, so you know that you're seeing someone that has taken a lot of thought and consideration and making sure that this is the right thing for you and guiding you. I'm sure you also guide them in a different direction with something that you feel would be of benefit to them. So that's really, really good.
Definitely. And I like, so even though I do the work in the context of the 10 series, I invite you to just come and get the intro session. It's basically to help answer all your questions. I mean, people don't want to invest in 10 sessions if they don't see any magic for them.
That's a good point. That's a good point. So you offer an intro session. That's a great point, because there's nothing like maybe experiencing a little taste of this so that people can make a better decision if it's right for them.
Correct.
That's great. That's great that you offer that. And what are the age ranges? I mean, I was looking through your videos. It looks like you treat adults and children.
I do. Some children. So some children that are born with scoliosis. I have a video out. The young lady has been getting worked on since the age of 7. And, but she actually started gymnastics when she was 3 years old. So by the time I saw her at 7, she already had patterns of a gymnast. She was trained to externally rotate her feet, which started to affect her hips and her shoulders and her whole structure. And I love it. I have some before and after pictures. Children don't need the same 10 series depending on where they're at. Because their bodies change really quickly. They haven't been sitting at a desk for 20 years. So their patterns come out really, really easily. So it's a modified series for them, basically.
That's great. That's good. So what is the youngest? What's the youngest?
The youngest was a 10-month-old baby.
Oh, what was that case? What was that case about?
That case was a half of a twin that just had some neck issues, and the doctors were talking surgery basically, and
Wow.
had worked with the mother's parents prior. So she thought she'd bring them in and to see what we could do. And during the session, he actually so he was refusing to turn his head basically.
Right.
So that was an interesting case, because what came of it was that it was, the position that he was in was
Right.
part of what was still in his neck. But,
Yeah.
He's making it for his brother.
I love that. Yeah. So you worked on the fascia.
Yes, I did. And that was super interesting.
That's great to know. How long did that take you?
We only did one session, actually.
I would imagine that would be my guess, that it would be quick.
Yeah. And so, and
that's wonderful.
I don't know that it was like even a cure-all, but again, sometimes people just come in for one session again to see, is this the right therapy for me?
And that's important.
Results.
That's really important. So it's really open to almost any age. I mean, here you are treating a 10-month-old, and what's the oldest client you've had?
Oh, the oldest was an 80-year-old man.
Yeah.
He was so awesome. He had heard about Rolfing before, and I love his story. He was a dancer, a tango dancer, and tango dancers, it's all about posture when you dance. Right. And even at 80, he was noticing that his body hurt, his back hurt, and he went through the 10 series. And he was really amazing. If something got to be too much, he would hold my hand and he'd tell me it's time to move on.
So he was still dancing? He was dancing at 80? Love that.
At 80, in fact, when he was done with the 10 series, we took before and after photos, and I love what he said. He could dance for 5 hours before he actually needed to sit down.
Wow.
So that's
powerful.
Result.
That's powerful. That's wonderful. So you told us your youngest, and you told us about your oldest patient. And there's a huge range there. So that's a beautiful thing. That's really nice. Also, what I wanted to ask you is, you mentioned posture, and I was going to ask you how does this benefit posture for everyone out there listening? Because many people need some improvement in posture and flexibility. Can you expand upon that?
Sure. Well, I would say that there is no, we want to improve posture, and we have some guidelines, but it's not going to be the same for everybody. We don't, everybody's body is different. Their structure is different. So, it's just, we want your posture to support you throughout the day, not to be more in pain.
Right.
For example, it's not one posture, but one thing that shows up And it's, I don't know if this is you or not, but did your parents ever try to correct your posture at a dining room table when you were young?
Yes.
Okay. Do you remember what they said to you?
Enderezate. Up.
Okay.
Stop slouching.
So no slouching. So would you pop your chest up, neck up, shoulders back?
Yep. That's what I would
like,
do.
Okay. Well, that correction, just know that your parents meant really well. But there's some people that actually still hear that. And actually that posture will create severe neck problems.
I'm glad I brought this up.
So I say that. And so, you know, what else can create that posture is that nowadays we work at computers, right? So
yes.
A lot of times, you know, as we start to get older, maybe, you know, just the computer, we start to squint. Yep. We start to sort of lean in with our chest.
Yep.
Kind
Shoulders
of look
forward.
up a little bit with our chin. And guess what? That's a pattern that's coming into our body. And, you know, so what's happening to your lower back? You're giving up so much, right? And I say that because when people come in, they think they're correcting their posture, and that's what I have to undo. The posture that they think that they're correcting, that's helping them, is actually creating some of the pain.
Great. You probably help flexibility. I mean, if you're working on the fascia, you're loosening them up, right? You're improving circulation, right? You're improving circulation to the body tissue, to the fascia. You're improving flexibility, I would imagine.
Sure. So have you ever eaten taffy?
Yeah.
Okay. So, you know, as you eat taffy, like it goes like from cold to like you heat it up and then it starts to get really long. And well, that's how fascia is. And so basically, as I'm working, I hear this all the time. People want to, like, they get off the table and they say, I feel like I'm an inch taller, like within the context of one session. So by the time I'm done, they're like, wow, they know that they've lost height. Like you can look at your parents, and if they've started to curl forward, it's because gravity has an effect on their spine, and that's literally they're sort of shrinking. So yeah, this work, it's gonna elongate you like that taffy.
That's great. That's important. Yeah. And so I would imagine, do you give them anything to take home with them or to do when they're done with their 10 sessions? Any kind of exercises or stretches that you recommend or practices that they can do from home on a daily basis?
Sure. We mostly, so from session to session, there is, we'll call it homework. But the homework is really, we call it owning the space that you were just given. So on session 1, I tell my clients, please turn on an alarm on your phone. I hope it can go off several times a day as a reminder for you to check in. It's an awareness thing. We want you to check in. I want your phone to say, are you breathing into your back? Because if you've been breathing like this for 20 years, we have to override this pattern. And it's up to you. It's going to happen in time, but the practice begins as soon as you're putting your clothes on.
Awareness first, right? Awareness is the first step for all health and transformation. Yeah. So I love this. This is great. So you give them some instruction, some homework. I think that's very
homework. Like session 4, I'm going to teach you how to sit. Like how many people just plop down? Sometimes I see people like they're totally sunk in their pelvis, and I'm like, oh my gosh, their tailbone is breathing.
I hope I'm sitting correctly.
So, you know, there's a future client right there. And so, you know, again, you could do things as kids that you can do for a long time and it's not creating pain. But as we get older, not paying attention to those things, maybe sitting in an office chair, that's creating a different dynamic. The car that you drive, you don't think of it, but so many people, like, you could have gotten a whole 10 series and I've taught you how to sit, but not until I go out with you into your car to show you that your pelvis is not level because of your car seat. Like, that's pretty eye-opening that most cars, like, each one has a pattern in them, and that could be affecting your back and your hip.
Right. That's great. You're just bringing this awareness to them so they can understand all the things that affect our bodies, right? And if it affects our bodies, where our minds and emotions are affected, do you get into the mind and the body and the thoughts and the emotions? Does that come into play here in Rolfing?
We do, but we don't chase after it. Meaning, if I'm working with a client and all of a sudden they have an emotional release, then yes, it's because, and the expansion of space, like they had that energy was no longer present or could live in their body and somehow just needed an exit. And like, that's what happens is we store different emotions,
In the body.
traumas, you know, so time and space can get stuck in our body, but we just aren't aware that it's there. I mean, I've had sessions, I received the work and very regularly. And one of my last sessions, and I've had many sessions, so you never know when it's going to show up. But when it does, it's like, oh, wow, that was just some energy leaving my body. And like, yeah. Wow.
That's beautiful. Totally, that's really important, because when I talk to my patients, I'm like, you know, your body can hold these memories, these experiences. And so Rolfing can facilitate the release of the emotional experience. Is that what you're saying? It can facilitate a release of it, and therefore the healing of it in a way.
Yes, and clients don't have to be scared, because I've had some people say, oh, I don't want to try it because I'm afraid that this will happen. But that's why I say I don't go after that. It's the body will spontaneously heal itself. That is the goal of Rolfing. That's what I love.
Yes, because I love the quote again. Like, you can go back to that quote. It's about organizing the body. Is that what you said? Like the quote by Ida Rolf. It's about organizing the body, reorganizing the body so that it can heal itself.
Correct.
Exactly. So in so doing, as you're Rolfing, you're reorganizing the body, you're allowing that space for a release, an emotional experience that gets released. And what I tell my patients, that's very healing. And you're going to feel different. There'll be a shift in how you feel in your body if you allow this to happen. So I'm happy that you don't chase after it, but I also am happy to hear that you are prepared for it too, that it's okay, that you're going to guide them and let them know it's okay, that it's actually quite beneficial to their health and well-being to allow this process to occur. I would say as a physician to welcome that, and you can come see me or talk to your doctor first, of course, but that is very healing, that the body does hold these experiences, and it can make you sick. It can create dis-ease. Okay, so we know that these negative, emotional, painful experiences can be held in the body tissue, and it can create disease. So can you expand more about that, about how Rolfing can help with that, right?
Yes, definitely. So a lot of times we're just not aware of those spaces in our body. But that's what structural integration is. It's just, yeah, I like to use the words, we're going to bring your car back to factory specs. You know, when your ankle used to move up and down, not, 30 degrees to the right.
Yes.
So
I love that.
Learning how to move through the joint, not the compensation that you've been walking with around the joint, basically.
That's right.
And so in that, to allow the body to create its own healing. How many times do I have a client just to move off the table and their body just spontaneously will adjust itself, and they could have gone to a chiropractor in the past. So for them to witness that their own body's intelligence, it will heal itself. And I remind them, I'm like, right now, this is your body healing itself. It knows where it wants to be, the bones, everything. So
it does. I love that. I love that you do that. That's really important. That they're supported, and guided by you in every way. In every way you're teaching them. Would you say that you're empowering them in their own health and well-being? Would you say that you're empowering them with their own health and well-being?
yes, that is the whole dynamic of structural integration. That's why I say I'm not healing you. I'm just putting the order in. I'm just the mechanic. And your body, your higher intuition, it knew to bring you here, and it knows how to heal itself.
Yes, perfect. I speak that language too. I tell them, your body can heal from this. You just have to figure out, what's the best way, right? We have to consider everything. And that's why I love that we're here talking about Rolfing, so that everyone out there listening can, it's been around for a long time. How long has Rolfing been around, actually?
I know Rolf, when she first started, I want to say it was before the 50s, but it didn't gain its height and momentum until the 70s.
Okay, so it became much more popular in the 70s, but it began in the 50s with Ida Rolf. And that's why it's called Rolfing, right? So
yes, it's called Rolfing. Actually, she first named it structural integration.
Okay.
But the name Rolfing really caught on. It was much easier to say.
We're going to structurally integrate you.
Yes. It is a trademark. And so hence why I'm actually an advanced practitioner of structural integration. There's different schools out there, so it depends on where you graduated from. But yeah, we owe it all to Ida Rolf.
Right. Perfect. And so what are the other health benefits, or can you name some of the common conditions? I can bring up some in my family practice. I have a primary care office. We integrate functional medicine, root cause medicine. We try to get to the root cause. And of course, the body's structure, fascia, anything held up in the body tissue, is important. How about scars? Can you talk about how Rolfing can help benefit any pain that remains in scar tissue and scars? Can you talk more about that? Anyone out there listening that may have some chronic pain after a surgery that happened many years ago and no one's really able to help them?
Well, interestingly enough, a lot of my clients, when they first come in, they do have to fill out a waiver, and that's some of the ways that I find out that they've had a surgery. But most of the time, they totally forget. They totally forget about surgeries, but the body will actually tell me. The body's telling me a story. I like to say it's whispering to me. I'm just a translator. And funny enough, the body will tell me things that I'll have to start asking you questions, okay, something's going on here and the body wants me to ask you questions. And it could be because they forgot about the surgery that they had when they were 8 years old. To them, in their mind, it happened so long ago, it's not pertinent to their story, but the body doesn't think that way. The body is no, this is my timeline. And so women with C-sections, especially when they come in for a lower back pain and in their belly, they have maybe even more than one C-section. And I'm okay, so before we address the back, we have to address the front because the front is pulling on the back.
That's great. That's important.
Yeah.
There's many women out there that have had C-sections. I've had two. So, and I get many patients that still, have pain. And I'm so happy to know that this is an option for them. Do you work with the scar tissue using Rolfing?
I do. I work actually right into the scar, but actually it's almost like we have to release the energy of the scar, because that's how scars release. They're holding on to the trauma, and you have to sort of, quote unquote, unlock them a certain way where they will allow the receiving of the energy first and then to let go. And then you can start to kind of unwind the scar. And then usually what the scar does is it adheres to bone. So something you don't think about is that the scar tissue alone is going to be like in your pelvis. Yeah, the surgery happened here however many years ago, but guess what? It grew like a weed and it got stuck to the bone. So you might be thinking, oh, I have a hip problem. I sit down, most of the day. It's my sitting. Or you could have that awareness, but in all actuality, it's like, okay, well, first things first, let's talk to this scar, because the scar is impinging it all. It's like the safety pin that we have to release.
Got it. And that reminds everyone out there how the mind and your emotions, affect your body, how emotions are held in a scar. So that's really important, and that you can help them heal the pain around a scar and release that tissue and release that pain. Correct? You facilitate that. Yes.
Yes.
Provide the space for that. That's important. And can you give some examples of how maybe patients can avoid having surgery? In some cases, have you been able
That's a tricky question.
Has Rolfing been able to prolong or deter the situation? So patients sometimes are told the only way to heal this is with surgery, and maybe their intuition tells them, not feeling that. I'm thinking there's some other way. Is Rolfing something people need to consider? What circumstances or situations, if you can give some examples?
Well, actually, one specific client comes to mind, and he actually wrote this as his testimonial. And he actually said that I had saved him from lots of surgeries. And that would be, he came to me with a prior shoulder surgery. He likes to spin a lot, and just whatever he does, when he can go to WebMD, and all of a sudden it'll say, these are your options. And he'll be like, nope, we're going to go see Ivette first. He actually said that I've saved him from carpal tunnel surgery. He was feeling like numbness in his fingers. And he'll come in where he will actually go see a doctor, and the doctor will say, that's it, you need surgery. And then he'll come see me, and all of a sudden he feels like his wrists are unjammed. He's no longer feeling the tingling in his finger. So that's just one specific case. Obviously, every case is different. Again, it's a choice. It's a choice to, I think if once you hear the word surgery, you're gonna do whatever it takes. Like another client of mine I'm seeing right now, he had knee surgery, and he had manipulation under anesthesia, and he had that twice. And now I'm trying to get rid of the scar tissue from those surgeries. So it really just depends. It's a case by case thing.
And if anybody do you have a YouTube channel? I
do have a YouTube channel.
What is it called?
Just like the website, ROLFMESI, Structural Integration.
Okay, everybody, because I was on there. I was on your YouTube, and I saw how you treated a woman with a scar, and she had a tummy tuck. She had a very long scar, and I saw how you worked with it, and how gentle you were, and how you really do allow them to guide you, and how you proceed. And it's a very everyone needs to know that she's definitely conscious of that, and you're going to feel very comfortable and in good hands. And so we're going to start wrapping it up. Believe it or not, there's so much interesting things to say about Rolfing. And thank you everyone for joining us and listening. And thank you, Ivette, Pinela, for being here today to talk about Rolfing. I could feel and I could see how much you love it, and how much you get out of providing this practice so that patients can find healing within themselves, and how you facilitate that for them. I'm sure you love that very much, and I'm sure you're going to continue to offer that. And I'm so grateful that you have decided to have a practice in this, so that I can now bring this into conversation with patients, since I'm their primary care doctor, and sometimes traditional medicine doesn't offer what they need. And it's important that I continue to be the bridge in all of these alternative methods that can provide a patient and lead them towards healing and recovery and things like that, and know that that's possible. Rolfing is available in Fort Lauderdale. Go to her website, go to her YouTube channel too. That way you can become familiar with some case stories, testimonials, and things like that. Do you have testimonials on there?
I do on my website.
Great.
But if you just go to Google and just put in my business name, Rolf Messy Structural Integration, I've got plenty of them there. And then, of course, for on daily basis, I do post on my Instagram. So please follow me there.
And under the same name on Instagram?
Yes.
Great. I love that. So that's important, everybody. We both Ivette and I believe in empowering you with information that can help you heal yourself from anything. And I really do hope that if Rolfing resonates with you, that you go see Ivette, go to her website, give her a call, make that introductory appointment so you get to meet her face to face. You can feel that positive energy that she has. Because I feel it. As soon as I started to speak with her, I felt her positive energy. And, you know, that has a role, too, in that experience. That when a provider really believes in something that they're doing, it is that much more effective, right? It just, the patient can feel that, and they feel they're in trusted hands. And, you know, we try to provide that at O Health. And 23 years doing this, you never stop learning and growing, and all the different ways that you can do what you do better, right, Ivette? And so thank you so much. This is O Health TV, a YouTube channel where I am the bridge between traditional medicine and alternative medicine, and provide you with information to empower you to take care of your health, mind, body, and soul. That O Health TV is the platform for you to come and learn something new, and to see if it resonates with you and can help you. This show is for you, to provide you with that information. I'm so excited you've joined us, that you are listening to O Health TV. I'm Dr. Marlene Cordova, and this is a show about Rolfing with Ivette Pinela, and I hope it helped you with your health journey. Know that this is a show for you to always learn and grow, to empower you with all the ways that you can heal from cell to soul. This is Dr. Marlene Cordova, and thank you.